A young mom was diagnosed with stage 4 metastatic breast cancer last year. Doctors gave her 5 to 7 years to live, and she decided that was not going to work. So when a doctor at Moffitt Cancer Center gave her the option of an experimental treatment, she jumped on it. I had a conversation with that doctor to learn about the groundbreaking research happening right here in Tampa Bay, and I listened to the young mother about her decision to take a chance.
So my cancer journey first started when I was pregnant with my second son in Birmingham, Alabama. I noticed a lump in my left breast, and I brought it up to the nurse practitioner overseeing my care.
Dallas Carroll tells me months went by.
I consistently brought it up, and it was always kind of pushed back that it was just normal hormonal changes.
And finally, a few days after she gave birth to her son,
An ultrasound, a mammogram, and a biopsy on December 7th.
doctors confirmed her fear. She has breast cancer.
Then by December 17th, it was confirmed stage 4. So it had spread to my liver and my bones.
We met Dallas in between appointments at Moffitt Cancer Center. She's here in Florida now, moved here with her family for treatment.
And they told me that I could do standard care, which yielded 5 to 7 years left to live. And as soon as I heard that, I decided that wasn't gonna work for me. Because that would put my youngest at 5 or 7 years old and my oldest at like 8. And they need a mother longer than that. So I said no. And Dr. Zernicki said that he had a vaccine that he could try and I would be the second patient. And I said, okay. I didn't care what it was. I was already gonna do it.
We're using the person's own immune system to treat their cancer.
Dr. Brian Zernicki is the chair of the Department of Breast Oncology at Moffitt Cancer Center. He breaks down the dendritic cell vaccine.
So it's a cross. It's a vaccine, but it's also a cell therapy.
And the shot goes directly into the tumor, did I?
Yeah, that's what we found it works best. In fact, if you give it even in the organ but not into the tumor, it doesn't have the same effect as when it's put in and admixed into the tumor microenvironment.
Moffitt allowed us special access into the lab where researchers are working on these personalized vaccines to learn about how they're created, as long as we didn't show anything that could compromise the scientific process.
What it's doing is reprogramming the area where the tumor is, because when a tumor forms, it's not all cancer cells. It's composed of a lot of other cells to help it. Now those cells get reprogrammed to be anti-cancer, and when they get programmed that way, now they can go out to other places in the body and they're told, oh, anti-cancer, we'll get rid of it wherever you see it.
Dallas is one of 2 young women with stage 4 HER2-positive breast cancer receiving this treatment. But doctors have already done trials with other subtypes of breast cancer. What are some of the results that you're seeing?
So we've been seeing like breast tumors disappear in the breast, the primary tumors, go away even without any chemotherapy.
Scientists are creating personalized vaccines. Here, they're preparing the one for Dallas.
I would get those weekly, and literally I could feel like the tumor getting smaller each week.
She's had 2 rounds,
The spots on my liver are completely gone.
then chemotherapy, and is now waiting to get approval for a 3rd round.
Dr. Zernicki thinks that with the next round of vaccines that he can clear the rest of that tumor, and if not, he can just do a lumpectomy, which normally stage 4 doesn't really have any surgical options.
What is it like for you to be able to have that option when this was not even on the table a year ago?
It's so surreal. Like, sometimes like I'm still like laying in bed with like my eyes wide open at night, and I'm like, what is my life? Like, how did I get so fortunate but so unlucky at the same time with this diagnosis?
For Dr. Zernicki, the future of this science is bright.
The realization that we might be able to start treating at least this subset of breast cancer patients without chemotherapy, who normally get pretty high doses of chemotherapy, is pretty remarkable when you think about it.
For Dallas, this is another step in her fight to be here for her family.
And to be able to still be here with my kids, it's just all I want. I just really, really need to be here with them, because They have a lot of people that love them. But I want to love them and take care of them.
Dallas is such an incredible young woman. You could see she's really fighting for her family. And really another big part of Dallas's story is how she advocated for herself. She said something felt off and she kept saying something was wrong until someone listened to her. Clearly she was right. She says, you know your body the best, and find someone, a doctor who will listen.
Yeah, and the courage for her to try something that wasn't exactly a clear answer, and she went with it, and that, you know, obviously a good result.
One of 2 patients. So we'll be following her story, but we thank Dallas. Yeah.
Thanks, Lauren. Appreciate it.